Good morning. I'm State Health Officer Don Williamson. Let me thank you for taking your time this morning to be with us. This is an exciting day for Alabama. In 2007, when legislation was passed, and beginning in 2008 with the establishment of the first trauma region, we have been on a journey to create a statewide trauma system in this state. Now, unlike many states where they've had tens of millions of dollars to build that trauma system, in Alabama, our trauma system has had to be built on the voluntary participation of hospitals and physicians around the state of Alabama. Several years ago, we were able to get all of Alabama included in the trauma system except for the southeast region of the state. Today, we announce the completion of our statewide trauma system with the inclusion of southeast Alabama from the Autauga County area, Autauga-Elmore County, all the way down to Dothan, over to Russell County, to Lowndes County. We include now all of the state of Alabama in our trauma system. Why is that important? The trauma system has never been about the health care that the majority of Alabamians get. For most people who go to the emergency room, you'll go to the same emergency room you've always gone to. But for a small number of individuals, being routed to the right hospital first, where they can provide the essential care that may be life-saving, makes an enormous difference. As an example, in the rest of the state, since we've had a trauma system operating, we've seen the average length of stay go from about 5.7 days down to 5.2 days. That's a 10% reduction in the length of stay, probably driven by the trauma system. We're convinced that with this rollout now in southeast Alabama, we'll be able to see this same improved, shortened length of stay occur in this part of the state, as we're now able to route patients not necessarily to the closest hospitals, though for most people it will be the closest hospitals, but more importantly, we'll be able to route people to the hospital that best meets their urgent care needs when they've had a life-threatening motor vehicle accident or a life-threatening fall or some other serious injury that requires entry into the trauma system. So I'm going to turn this over now to Dr. Sarah Nafziger. Dr. Nafziger is the Assistant State Emergency Medical Director. Again, let me thank the doctors and the hospitals in southeast Alabama for having made this now almost decade-long journey possible. And we look forward to the positive outcomes that are going to occur because of this now statewide trauma system. Sarah?
Thank you very much. I would just like to reiterate that trauma is a big problem in the state of Alabama. In Alabama, 1 in 3 deaths are caused by trauma. And if you look at the younger age groups, people less than 45 years old, it's the #1 cause of death. In fact, if you look at the youngest age group, 15 to 24-year-old people, it causes 73% of all deaths. The whole reason that we're taking on this endeavor is to reduce that death rate, to allow loved ones to go home to their families ultimately. So in Alabama, we're not talking about all trauma patients. 90% of trauma is minor and does not require the kind of care that we're talking about. But what we're talking about is the most severely injured patients, approximately 10% of all trauma patients. And we're trying to route them to the facilities that have the resources that are available at the right time to care for them. I'll now turn it over to Mr. Joe Acker, the Executive Director of the Alabama Trauma Communication Center.
Thank you, Dr. Nafziger and Dr. Williamson. I can assure the general public that a month from now, there will be people alive in the southeast region that would not have survived previous to this day from trauma. Almost 10 years ago to the day, then Governor Riley and Dr. Williamson had a conversation, and they made the decision to move the trauma system statewide rather than in a single region in the Birmingham area. We saw tremendous changes in mortality and also in length of stay and quality of life. This system will make a big difference, but it's the physicians and the hospitals, Dr. Williamson's staff, that has endeavored in this 8 years to make sure that we continue toward the goal of a trauma system statewide. Alabama's unique. This is the only system in the U.S. that maintains the knowledge of the hospital availability and centrally routes those patients. It pays dividends in lives. And all of us who are citizens of Alabama need to appreciate what Dr. Williamson, his staff, Dr. Vermillion, and the physicians in this region, and Dr. Campbell, who was such a tremendous backbone in this process, how much difference it will make in the quality of life and lives saved in this multi-county region of the Southeast.
Thanks, Joe. Let me just make a couple of closing comments, and then we'll answer questions if there are any. There are a lot of states that have trauma systems that cover parts or even all of their state. Alabama is unique, as Joe said, in a couple of important points. Number one, rather than having 8 or 10 different dispatch centers around the state to route trauma patients, Alabama does it from one site. We'll do it for one site throughout the state from Birmingham. Secondly, the trauma system that we use allows in real time a hospital to tell us they are overloaded with trauma, they can't take any more patients, or to tell us in real time that their neurosurgeon is already occupied and can't take another neurosurgical patient right now. That gives us our greatest chance to ensure that patients do go to the right place the first time, and that we maximize the benefit of that golden hour when we can save lives, prevent disability. And again, as was pointed out, there have been real champions for this trauma system. There's been no bigger champion than Dr. John Campbell, who spearheaded this statewide, and here locally, Dr. Vermillion, who has led the charge now over several years to bring the last part of the state into the statewide trauma system. So, this is one of those things that we can be very proud of as Alabamians, that we've done this. We didn't do it the way other states have done it when they had $40 and $50 million that they could pay for indigent care. That would have obviously been very nice, but instead we've done it by doctors and hospitals getting together and voluntarily participating, because they knew that in the end it would reduce morbidity, reduce mortality, save lives, and actually be the most efficient use of scarce health care resources. So let me pause with that, and we'll be glad to answer any questions. Okay. Yeah, sure.
Can you provide kind of a theoretical, like how would this work if I, like say, I lived in Autauga County and something happened?
Okay. All right. Let's just use hypothetically Autauga County or any county. The general way that most people think about a system working is, if I'm in an automobile accident, the ambulance comes and picks me up, and generally, in most places, you're taken to the closest hospital. For 90% of the patients who are in that automobile accident, that's exactly what's going to happen in this system. You're going to be taken to the closest hospital. But for 10% of the people, maybe 5% in some situations, you're going to be evaluated on scene, and you're going to be determined that you need health care. You're going to need an intervention that your closest hospital can't provide. And based on some built-in time factors in the system, you're going to be routed to the closest hospital that can provide that need. As an example, let's assume your closest hospital doesn't have a neurosurgeon, but you've got a closed head injury, and getting you to the closest hospital would waste time that might be essential in saving your life and reducing your disability. So instead of you going to the closest hospital, getting stabilized, and then getting referred to the neurosurgeon, Now you go directly to the hospital that has the neurosurgeon available. Another example, let's assume you've got a major pelvic fracture. Instead of going to that closest hospital that doesn't have an orthopedic surgeon, that doesn't necessarily have the capacity to provide you definitive therapy for your pelvic fracture, this system would route those very few patients who need that more advanced care directly to the hospital where they can get that advanced care. The effect of that is those minutes saved by not being routed one place and being referred then to another place, those minutes saved have been shown to reduce the death rate and to reduce the length of hospital stay. It only applies to a small percentage of patients with trauma, 5 to 10%. It's not going to change where 90% of people go to the hospital. But it offers for that 5 to 10% of people who have severe trauma the opportunity to get to the right place the first time. Other questions? Okay. Well, thank y'all very, very much.